Every year in Canada, the government spends billions of dollars in the healthcare system treating diseases and health conditions that are entirely preventable. And many of these diseases and conditions trace back to the fact that we as Canadians, well, we're not exercising enough. Our diets aren't so healthy, and maybe we're smoking too much and engaging in other decisions that are having significant consequences to the healthcare system. Well, today we're going to talk about one of those problems, the fact that we're not getting enough exercise. And we're going to chat about something really interesting that they do in Sweden to encourage more physical activity. And joining me today to talk about this issue is Dr. Mats Borjesson. He is a professor at Sahlgren's Academy at the University of Gothenburg, Sweden. And John Weston is the president of the Canadian Health and Fitness Institute. So thank you both for joining me here today. John, I wonder if you could maybe tell us a little bit about your organization and also about the big picture problem that we have here in Canada with Canadians not getting enough exercise.
Well, Colin, thanks for having us both on and for introducing me to a very key co-panelist in Dr. Borjesson. It was music to my ears when I read your August 2023 report, when you said there are many reasons for Canada's healthcare woes, but healthcare reform discussions tend to focus on how to improve the services provided rather than reducing demand in the first place. Right on. And increasingly, people are waking up to what I call Canada's most important quiet crisis. It's quiet because it's sedentary behavior. People don't move as they did in generations before. We have rising tides of sedentary behavior driven by screen time and labor-saving devices. People have heard, I think, that we have a third of our youth in Canada who are overweight or obese. And someone who is obese as a youth is likely 14 times more likely to suffer a cardiac event by age 50. Along with that comes increased diabetes trends and outdoor deprivation, which means people just aren't getting outside and playing and moving as much as they used to. That means that there are lonely people who are suffering increasingly from mental illness. And just yesterday, the New York Times reported that 63% of young people up to 24 years old have mental health issues, 63%. And the Globe and Mail reported just a few months ago on a word that I'd never heard of before called suicidicity, which is the trend to think about suicidal thoughts. So we have a real major problem in Canada. I believe it goes right to the erosion of individual capacity. And when I was a politician, a member of parliament, I was mesmerized by the fact that we in government were always transfixed by the current crisis, the crisis of the day. And we were unwilling or unable to deal with issues that extended beyond the term of a political mandate, which tends to be around 4 years in Canada. And so this is something that the Canadian Health and Fitness Institute has grown up to tackle. We're saying that governments and government-funded organizations are not doing the job, nor can they. And corporations don't find as their number one motivation to deal with issues like Canadians' health. That's why the Canadian Health and Fitness was founded.
Thank you for helping to lay the foundation for the problem. I mean, it's this issue in Canada, and thank you for mentioning that report that we authored. Dr. Borjesson, I wonder if you could tell us a little about how Sweden has been tackling inactivity, the notion of physical activity as a prescription PAP. Could you tell us a little bit about that?
Yes, thank you for having me on the show. And I agree with the overall picture here. And I don't think it's a Canadian problem. It's a global problem, and it's a Swedish problem as well. I think we all have to increase our lifestyles, our lifestyle behaviors to increase our health. And the starting point is, of course, that many of us have done research on the health benefits of exercise, for instance, what we're talking about today. But the reality is also that it's very difficult for people to change lifestyle behaviors, including be more physically active. And we need methods that are efficient and proven, evidence-based to increase physical activity. And one such method is the Swedish system of physical activity on prescription. And we are proud of that.
Dr. Borjesson, I apologize. We have to take a commercial break. We'll be back in just a moment.